This is the OVHL training for outpatient clinics that is doing counseling only, and we will also cover the approvals. So, this first section that we're going to look at is just kind of a brief overview of the Division of Behavioral Health, Division of Health Services, rather. The strategic priorities came into effect here for the last 3 years. This is our plan, and we're focusing on integrating physical and behavioral health services. That is the way that we are moving towards. There was a bill, House Bill 2634, that was put into effect that told us on or before July 1st of 2013, we are to redo the rules. Well, as you can tell, that's been postponed a little bit. Now it's going to be October 1st. The rules have been submitted, and the reasons for that is to hopefully reduce some monetary and regulatory costs for people, and also to streamline our process. There are folks out there that are in behavioral health that are also in need of medical services, and we're trying to hopefully be able to integrate that to streamline a little bit the care for the clients. The new and revised articles are now going to be the R910s. We formerly were the R920s. We're now moving to the 10s, and these are the areas that we're focusing on: health and safety, consistency for all healthcare institutions, again, streamline the process, integrate services, and then hopefully make some changes that are applicable in the 5-year review report. Oops, did I go quickly? The integration plan. Facilities now are going to be able to offer a menu of services. So you will be licensed to be either an outpatient treatment center, a residential facility, or an inpatient facility. Then you will just pick from a list of services, things that you can offer to your clients, and that'll be in your your menu of services. These are the varying services as well that give you some information. Okay, so rules were filed with the Secretary on June 28th, and the implementation will begin October 1st. We do have specific trainings that'll be covered. Again, today is our first training. We have another one later this week, and then next week will be residentials next week, and I believe inpatient is also this week. So medical will be putting some other ones on as well. So if you are doing more integrated services, there will be trainings put on September 16th and 17th. All the information will be on the website for you to sign up, and that is how you'll be able to sign up, by the way. Okay, what does this mean? Starting October 1st, you need to start following the new rules. You've probably heard us out there at your facilities over the past year and a half saying, guess what, things are changing, you need to start looking. So please start, if you haven't already, get on the website, get your rules downloaded, take a look at those, and October 1st, you will be needing to follow those rules. So start educating your staff, your boards, your executive teams, your physicians, everyone that needs to know. Educate them on what is going to be happening here starting October 1st, what they and you are going to be responsible for. So what has changed? We have just a little bit changes in definitions, some of the content, interpretations, the article numbers. Outpatient treatment centers will be under Article 10, so we're going to be R910, and then the rule number will start 10 something. Okay, for information, we have a rules implementation website, which is listed up here, and you can access the rules. There are different resources on there, crosswalks, frequently asked questions. There are PowerPoints as well as some online videos. Okay. This is the section in Article 10 that I was just mentioning, that you will be required to have compliance, the definitions, R910.01, R910.02. So these are the required compliance areas that you will need to make sure that you have looked at, that you have followed, check, make sure your P&Ps are current and up to date that reflect this. Optional scope of services. These are the different things, like I was talking about, the menu of services, that you can choose to add to your license. I don't think anybody in here is going to be doing dialysis service, Could be, possibly. But I doubt that that's going to be happening. If it does, this is where you would find that information. So, okay, I'm going to hand it on over to Brian, and he's going to start talking about Article 1 and going through the definitions.
All right, the way that we're going to kind of do this is we're just going to break it down. So this is kind of a line-by-line training. We're not going to go through everything because some of the stuff that hasn't changed, we're not going to really talk about. What we're going to focus on today is some of the stuff that is new and some of the stuff that has changed. So we're going to go through and kind of scroll down. So it's not like we're missing anything, but we just want to cover some of the main changes when it comes to this stuff. So you'll see as part of this in Article 1, these are the general rules. So if you're going to be an OTC doing counseling only, you're going to follow Article 1 and Article 10. And then depending on the services you're going to do, there might be some additional articles that you follow. So you'll see all of the stuff that's in here. They've updated all of Article 1 to incorporate what the new changes are, the new terminology is. We're getting rid of kind of some of the subclasses we had in the past. Some of them have been renamed. So this is going to be a good start for you to identify where everything is and what's changed as part of this. So a behavioral health issue means an individual's condition related to a mental disorder, personality disorder, substance abuse, or a significant psychological or behavioral response to an identifiable stressor or stressors. Okay. Behavioral health professional. This is one that really hasn't changed. And part of this is when we're doing this, these are still unofficial. So going forward, there are a few things that have been omitted, some things that were just missed on getting put in. So if you look, like a behavioral health professional means an individual licensed under ARS Title 32, whose scope of practice allows the individual to independently engage in the practice of behavioral health as defined in ARS 32-3251. Except for a licensed substance abuse technician engaged in the practice of behavioral health defined in ARS 32-3251 under direct supervision. Okay. One of those that I believe is getting put back in is that all of these folks are basically licensed through the Board of Behavioral Health Examiners, but a psychologist is not licensed to be the Board of Behavioral Health Examiners. That's one of those where they're actually looking at getting that put back in. Okay. Oh, and the one thing that did fall off was in the past an RN with 1 year of full-time behavioral health work experience was identified as a behavioral health professional. That's changed. That's no longer the case. Okay. Behavioral health services means medical services, nursing services, health-related services, or ancillary services provided to an individual to address the individual's behavioral health issue.
So Brian, so with the removal of the 1 year for nursing, they're just providing nursing services.
Correct.
That shows.
Correct. Now, one of the big changes has to do with supervision. In the past, BHTs and BHPPs, so behavioral health technicians and paraprofessionals, used to have to get a defined set of hours of clinical supervision. Clinical supervision has basically gone away. Okay, we'll have separate definitions for what a behavioral health paraprofessional needs to have, as well as what a behavioral health technician needs to have. A BHT needs to have clinical oversight. Okay? And that means monitoring the behavioral health services provided by a behavioral health technician to ensure the behavioral health technician is providing the behavioral health services according to the healthcare institution's policies and procedures. They have to provide ongoing review of the behavioral health technician's skills and knowledge and related to the provision of behavioral health services. Provide guidance to improve the BHT skills and knowledge related to the provision of behavioral health services, and recommend training for that BHT to improve their skills and knowledge. Okay. Now, for the purpose of this training, counseling facility means an outpatient treatment center that only provides and was licensed before October 1, 2013 to provide one or more of the following services: counseling, the DUI services, and the misdemeanor domestic violence offender treatment. Okay. Starting October 1, the department will no longer accept applications for an outpatient treatment center only providing counseling. Okay. So basically, you're being grandfathered in, and obviously you probably heard that term. There are some issues with the fact of being grandfathered in. Okay. Should you choose to move, have a change in ownership, and I can't remember the third one. We'll talk a little more about it. The department can no longer accept your application. Okay. So if you're in a suite number or at an address and you're wanting to expand, okay, we're not going to be able to license you as an outpatient just doing counseling after October 1. So you need to keep that in mind. Otherwise, you're going to have to do some kind of service that will throw you into what's called a healthcare institution. So you'll have to identify some kind of a medical service, or like the dialysis, all of that stuff that will get you into integrated health in order for us to license you. Okay? So that's a big kind of step that, as going forward, you're going to have to take a look at, because we've had that issue already come up with a few folks that are in that process of kind of identifying that maybe they would be moving. Well, at that point, you're not a counseling only facility, because we can no longer just license that after October 1. Okay? And we'll talk a little more about that going forward. And as we kind of scroll down, you can see that there's some other stuff in here. In Article 1, it's basically definitions for all the healthcare institutions. So not all of this is going to be applicable to you. You'll see some stuff in there for like an outpatient treatment center, on architectural review, all of that stuff. Just keep in mind some of it's not applicable. Now, just like clinical supervision, clinical oversight, direct supervision has changed, so has training. Okay? Training in the old OBHL has now become in-service education starting October 1. And in-service education means organized instruction or information that is related to the physical health services or behavioral health services, and that is provided to a medical staff member, personnel member, employee, or volunteer. Okay. Another thing that's really going to be a change for the outpatient treatment centers going forward has to do with the quality management program. And Alice is going to talk a little bit about that later. But that's one of those things that's going to be very universal for all of the behavioral health licenses, is that every entity will now have to develop a quality management program. And Alice will talk about that later. Scope of services means a list of the behavioral health services or physical health services the governing authority of the healthcare institution has designated as being available to a patient at the healthcare institution. Okay. Currently, right now, you guys had to provide a program description, okay, where you kind of detail what it is you do, how you do it, all of that stuff. That's being basically replaced by the scope of services. you're going to kind of define, when it says means a list, you're still going to have to describe very basically what it is that you're going to do, how you're going to do it, who's going to do it. But you'll see on a lot of the places going forward in October when the new applications come out, is that some of that information that you had to provide in the program description is now going to be on the application. So the one big thing had to do, you remember you had to define when your clinical hours were, when your administrative hours were, all of that stuff. That's actually going to be on the application going forward. So you're still going to have some of that information, but a lot of it's going to be going away, and then you have to identify what your scope of services are. And you can see these are the healthcare institution classes and subclasses. So if you're familiar with the way that we currently licensed places, is that you'd have an outpatient clinic. We license level 1 subacutes, which are basically our highest level. The psychiatric acute hospitals are under medical licensing. Then we have our residentials. So we have 3 sets of residentials. We have a level 2, a level 3, and a level 4. And then we go into some rural substance abuse transitional facilities, adult therapeutic foster homes. We're getting out of all of that. So basically we'll have, I think, 5. But there's 3 real sets that we're actually going to license now. We're going to be inpatient, outpatient, and residential. Okay. There's not going to be a level 2 or a level 3 that we license anymore. So you will be a residential. Also going forward is that currently on your license, it has you as an outpatient clinic. Okay. Going forward, when the next wave of applications and licenses go out, you will become an outpatient treatment center. So you will become an OTC. And that'll be just based on when your license, current license, expires and as you put in the renewal applications and all of that stuff. So nothing is going to change. Not all the licenses will expire October or September 30th. Okay, everything will be a rolling kind of rollout once you have to do your renewal applications. Okay. So again, what we're talking about today is the outpatient treatment center and a counseling facility. One of the other things that has changed has to do with us licensing a branch office. Okay. In the past, we used to allow that an outpatient clinic could set up kind of a branch office as long as they didn't use it for more than 20 hours and all of that. Okay. Branch offices are not going to exist after October 1st, and that does not mean the same thing as a satellite facility. Okay. Satellite facilities have to fall under the jurisdiction of basically a medical because it's based out of a hospital. Okay. So if you're going to do services at any location that like is your standing location, not out like in the community if you're doing something like that, it has to be licensed because branch offices will no longer exist going forward. So again, this is kind of what I was talking about, the approval of architectural plans and specifications. That's only as applicable. Now, going forward, they're still in the process of kind of adopting what the forms are going to look like, when we're going to start accepting all of that stuff. So it's kind of dependent on when your license expires, depending on what type of forms that you're going to have. Obviously, all of that stuff will be online once the form is approved and it's developed. because going forward as of October 1, that's when we're going to start accepting them. Okay. And not a whole lot's changed with any of that stuff outside of the few additions that you're just basically going to pull from your program description and put on the application itself, like the administrative hours, all of that stuff that typically was on the program description. For the initial application and renewal application, none of the fees have changed for OBHL. The application fee is still going to be $50, and the license fee is going to be $375. And the renewal forms, all of that might change a little bit and be tweaked, but it's basically the same type of information. Now, the time frames have changed a little bit. So in the rules, you can actually take a look and see what the specific time frames basically are to get, administratively complete, the substantive review time frame, and the overall time frame, depending on what sort of information that you're looking at changing. Okay. And again, this is what we were talking about. Like if anything does change, there's the potential that it could change your opportunity and ability to be licensed after October 1, depending on what it is that you're doing. A change in the owner, a change in the address or location, and a change in the healthcare institution's class or subclass. Okay. Now you'll see stuff in here that talks about TB screening. Okay. Again, that's if applicable, and it's not applicable for a counseling-only facility. Now, it's dependent on whether or not what kind of service you're doing that would make it applicable. So for those folks that are doing the integrated health, it may become applicable. But as of you right now, being counseling only, it's not applicable. And again, you can just see how universal all of this stuff is because the clinical practice restrictions. So the good thing is not all of this is applicable, which makes it easier, because the whole point of kind of the integrated health was to integrate the health, but as you saw in the PowerPoint, it was to deregulate. So some of the stuff that we were very prescriptive before, we are not prescriptive anymore, okay? And we'll talk about that. Now, here's one of the big changes when it comes to how you're identifying and classifying staff. Has to do with behavioral health paraprofessionals and behavioral health technicians. And I'm basically going to kind of read this, then we'll go through it. If a healthcare institution is licensed as a behavioral health inpatient, residential, substance abuse, behavioral health specialized transitional, or authorized to provide behavioral health services, an administrator shall ensure that policies and procedures are established and documented for a behavioral health paraprofessional providing services at the healthcare institution. You have to delineate the services the BHPP is allowed to provide at or for the healthcare institution. If the behavioral health paraprofessional provides service under the practice of marriage and family therapy, the practice of professional counseling, the practice of social work, the practice of substance abuse counseling, you shall ensure that the behavioral health paraprofessional is under the supervision of an individual licensed pursuant to ARS 32, Chapter 33. Okay, you have to establish the qualifications for individuals providing supervision to a BHPP and establish documentation requirements for the supervision. Okay. Now, in the past, there used to be a definition. Okay, in the Title IX, Chapter 20, there was a definition of what a BHPP, their minimum skill set was. Okay, we had the same thing for a paraprofessional and the professional. Okay, That's no longer exists. Okay? You, as an entity, get to define that. Okay? So it's going to be policy driven. And you're going to hear us talking today a lot about this, is that since we deregulated, we are going to put more, we're going to hold you accountable to what your policies are. Okay? So for the paraprofessional, if they're providing any service that falls under the practice, okay, they have to be under direct supervision, which means that the professional who provides the direct supervision has to be in the room. Okay? Now, that's for the 4 practices: the social work, the professional counseling, the stuff that folks that are licensed via the boards actually do. So that doesn't mean that they have to have someone watching them when they're doing any kind of other service. So the case management, whatever they're going to kind of do in the community. None of that's changed. The only thing that's changed is how you define what it is, what criteria it takes to qualify as a behavioral health paraprofessional. Okay? You're going to have to do the same thing for a BHT. Okay? Now for a BHT, you have to delineate the services that the BHT is allowed to provide, establish their qualifications. If the BHT provides services under the practice of marriage and family therapy, professional counseling, social work, or substance abuse, you shall ensure that the BHT is under the clinical oversight of a behavioral health professional. Okay? So not a lot's kind of changed with that, except that now clinical supervision, now that the clinical oversight has to be done by a BHP. Okay? In the past, it used to be that you could delineate or designate a BHT to be your clinical director if they met the criteria. They had the 6 years of education and whatever it was. Okay? Now that doesn't exist. Okay? Clinical oversight has to be done by a BHP. Okay? As part of your policies, you shall ensure that if the clinical oversight is provided electronically, how you're going to do that. A secure connection has to be used. So the very over there general like Skype wouldn't work. However, Skype and some of the other do have some professional services. As long as they're encrypted, then it could be used. Okay. Then you have to just confirm that that BHP who's providing clinical oversight is actually who they are. Now, the other thing that's changed is that in the past, a BHT, if they were working full-time, needed 4 hours of clinical supervision in a month, or they needed 1 hour for every 40 hours worked. The same thing was for a paraprofessional. Okay, for a BHT, clinical oversight has to occur at least once during the 2-week period if the behavioral health technician provides services related to the patient care at the healthcare institution during the 2-week period. Okay. One of the other things that changed is that if they were on vacation, we wouldn't expect it to happen. Okay, or if they're on leave, some of the same stuff that's always kind of within OBHLs, if there's documentation on why it's not occurring, then we took that to account. So for BHTs, it goes to clinical oversight, and then there are the specific just times that it has to happen. Doesn't necessarily talk about hours. That's where it's going to be policy driven. Okay, if BHTs are providing services, how much clinical oversight are they getting? Okay. Same for the paraprofessionals, even though they might not be doing some of those practice, the social work, the counseling, the marriage and family therapy, and the substance abuse. Okay. Because if they are, then they have to be under direct supervision, which means that BHP has to be in the room while they're doing it. Okay. And then the documentation for all of it will be pretty similar. You get to decide the duration, but it still has to meet the needs. Okay. And as part of our discussion, when we get to our questions at the end of the training, we can talk a little more about that, because we want to make sure that's one of the big changes that's going to occur. So we just want to make sure that you guys get your questions answered if you have questions about that. Because Alice and I can't tell you how many questions we fielded when it comes to that, because there are folks that are kind of set in the old ways, you know, and we in-house are still trying to get our terminology right, okay? Because I still call it clinical supervision. It's not clinical supervision starting October 1, okay? It'll either be direct supervision for a BHPP, or it will be clinical oversight for a BHT, okay? So if you have questions, we'll be more than happy to field those. And then the counseling facilities, that's what we're talking about today. So the counseling only outpatient OPCs right now going to outpatient treatment centers. And then I don't know if anyone in here, is anyone in here working with what we currently license as an adult therapeutic foster home? Okay. Going forward, there is what we're going to have as a collaborating healthcare institution. If you ever choose to do that, they're changing what the definition of the adult therapeutic is, but then you would, if you do that, then you would be a collaborating healthcare institution and fall under those requirements. Okay. Okay, I'll turn it over to Alice. Now these were the basic definitions in Article 1. Now Alice is going to go into Article 10, which is going to be kind of the nuts and bolts, where we're going to talk about some of the services, the assessments, the treatment plans, what's going to be contained in the personnel, medical records, all of this stuff. So this will be kind of the nuts and bolts. This is where you're going to definitely kind of print these out, or at least have them available and be reading them, because this is what it's going to be starting in October 1.
Oh, let's see. What else am I doing here? All right. Is that big enough? Can everybody see that? In the back, you're good? Okay. All right. So we started out with R910-1001, the definitions. So we're going to move into, well, we will start out with that. Article 10. You have additional definitions in here. Emergency room services is not going to apply to you. Again, these are going to be universal for outpatient treatment centers. So if you remember all the list of the subclasses and the scope of services, that's what falls under this license. So some of this is not going to be applying to you. Okay. Your supplemental application, you're doing behavioral health services, and if applicable, here we go. These are things can be listed on your scope of services. Counseling facility can do the DUI and the DV. So again, as Brian was saying, we're no longer going to be doing a program description. That's kind of almost like a novel in some cases. It's a narrative of everything. You're going to be doing the scope of services. So your governing authority shall establish in writing your scope of services, and you will adopt a quality management program according to R910-1004. And when we get to that section, we will talk about that. Okay, your administrator will ensure that policies and procedures are established, documented, and implemented. More of the same things you've already been doing. Job description, orientation, CPR, if you're going to include it, if it's applicable to your agency, to your center. Okay. In looking at policies and procedures, okay. All right, so here we go. So policies and procedures for services provided at or by an outpatient treatment center, again, established, documented, implemented. You've got administrative P&Ps, and you're going to have service P&Ps. Again, they'll need to be reviewed at least once every 2 years or as needed as things change, because things do change, we know that. And they must be available to your personnel members and employees. One of the terms you're not going to see in here anymore is staff. It's going to be personnel member. Okay, so however you can make that available to them, whether it's online, a hard copy, whatever, you need to make sure that it is available to your personnel members and all of your employees. Because you, as an entity, you want to be sure that they are following them, right? That they know what to do. Okay, the information that needs to be conspicuously posted. We usually come in and we'll look for your board, right, up in the front typically in your lobby. We're checking to make sure you've got your license, you've got phone numbers, you've got addresses, you've got all the things that are required. It's gone down a little bit. We're not going to be requiring all those addresses and phone numbers on there as we previously had. And one thing that is in here, the letter F, a map for evacuating the facility. Previously, every hallway needed to have an evacuation map. You just need to have one. If you want to have one in every hallway, outside every door, every office, that's up to you. We're just saying our requirement is you need to have one. Obviously, that evacuation map isn't going to be held in the very front lobby, right? Because that's where you want your folks to get to. So you're going to put it in the back somewhere where people can see it, where they can get out. Okay. You will need to be providing patient follow-up instructions. I'm sure that's happening anyway. What is that? When somebody is leaving from an appointment from an outpatient treatment center, don't you typically give them a card or a reminder or something of when your next appointment is? That's giving them follow-up instructions. If they have another type of appointment, they're being referred to someplace else, maybe a physician, whatever the case may be, you would need to provide orally or in written form to the patient or their representative before they leave follow-up instructions. Okay. The reporting procedures are going to be changing a little bit. We do love to hear from you, and you may call with questions or things like that, but you no longer have to call in your incident reports. They are going to be submitted in writing. Okay? Still feel free to call. We're here. We're not going anywhere. And we will answer your questions, but you only need to submit those in writings. You don't have to do that verbally anymore. Now, this one here, if abuse, neglect, or exploitation of a patient is alleged or suspected to have occurred before the patient was admitted or while the patient is not on the premises and not receiving services, you shall immediately report the alleged or suspected abuse, neglect, or exploitation as follows. For a patient 18 or older, you're going to be calling APS. There's the statute information. For a patient 18 or younger, you're going to be calling CPS. And then F here just talks about if they are receiving services from you while they're on the premise and something happens. It's similar. You're going to take immediate action to stop the alleged abuse. You will immediately report it to APS or CPS in addition to law enforcement, and then document the action and maintain that documentation for 12 months. You will be investigating the suspected or alleged abuse, neglect, exploitation, and develop a written report. This is the information that needs to be included in that report, and the investigation must be done within 48 hours. You will submit a copy of your investigation report within 10 days to the department, to OBHL, and then you need to maintain a copy of that investigation for 12 months after the date of report. One thing I did want to go back again real quick is I said the word patient several times. That's another change in the verbiage. Because your outpatient treatment centers, healthcare institution, this is going to be universal for hospitals and other types of surgical centers. We'll be using the word patient. Okay, quality management. There is, if you go on to our integrated website, a link to a PowerPoint and also, I believe, a streaming video of a training that was done on a quality management. Basically, it's a plan that you are going to be putting together, and we may never really look at it, to tell you the truth. If you are identifying an issue that's occurring or has happened and you need to act on that, this is where you're going to have it in your quality management plan. How you made corrections. What do you have in place to deal with an issue that may have arisen? If we're identifying an issue when we're out at your sites doing a survey, we will talk about it, and you may say, oh yes, we have identified the same issue, and this is how we are correcting this so it doesn't happen in the future. Okay? So I would go into the PowerPoint and into that training on quality management plans, and that should help you in putting that together. But this is going to be for you in running your agency. Okay, contracted services. This is referring to outside services. Maybe you have a contract with a cleaning crew who comes in nightly. You have a contract with a transportation service. Maybe you're using one of the local cab services or something like that. That's the type of contracted services that this is discussing. Okay, this isn't having a contract with a nurse or a BHP. This is a different type of contracting. Okay. All right. Before I get into personnel, I wanted to, well, we'll go back. We can, during questions and answers, we'll talk about more about the policies and procedures. In personnel, again, as Brian was saying, we're not going to tell you what these folks need to have. You're going to be determining that. We will be reviewing your P&Ps and ensuring that you're following your policies and procedures. Are you hiring the type of people that you say you are? Are they getting the amount of clinical oversight that you say that they need to have? Okay. So the qualifications, skills, and knowledge acquired for each type of personnel member are based on the services that you're going to be providing, as well as the acuity of the patients that you're going to be working with. You'll include the skills and knowledge, type and duration of education, training that they'll need. You'll be documenting the information, the skills and knowledge. And orientation. The individual's orientation will be documented and will include the following information. You are going to determine what needs to be covered in the orientation and who is required to have that orientation. So transport and transfer. Okay. So you will, except for transport of a patient due to an emergency, an administrator will ensure that a personnel member coordinates the transport services provided to the patient according to your policies and procedures. Again, policy driven. If you are transporting somebody, they typically will be coming back. You're transporting them. You're providing them transportation from your clinic for an appointment to their home. Transferring is pretty much what it says. You will be transferring them to a different clinic. Maybe they need a higher level of care. Maybe they need inpatient, residential, something along those lines. So the transfer is a little bit different. Okay. Patient rights. This is going to be very similar to what you've seen, what you've already got posted. All of your patient rights. When you look through this, it looks a little bit smaller, but it's not. We've just kind of combined it a little bit to make it a little bit easier, streamlined it. Again, we'll use that term, streamline. So all of the patient rights are still as they were before. I am actually going to go back and make mention about policy again. We've said this before. Your agency is going to be policy driven. Okay? Your policies are what you have determined you are going to do for your patients, for your clients. And the procedure is how you're going to do it. So writing down, like our rules say, an administrator shall ensure, blah, 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 that's not a policy and procedure. Okay? Just let me think quickly, fingerprinting. Okay? If there's a policy and procedure on fingerprinting, if you require that, your policy may be agency XYZ will ensure the safety of their clients by ensuring that all staff are fingerprinted or have current valid fingerprint cards. Your procedure is how are you going to do that? Upon hire, a staff person must have a valid fingerprint clearance card or will have applied, and you'll keep an application affidavit on file. They're required to renew it a minimum 30 days prior to expiration. You're going to be verifying that it's valid through the Department of Public Safety. That's your policy and procedure. What you're going to do, ensuring the safety, the procedure is how you're going to do it. Our rule is the end result. So when you read the rules, you'll see, okay, that's what I have to do. How am I going to get there? So that's how you work with your policy and procedures.
Going into the medical records, you'll see not a whole lot has changed with this just because of there's multiple federal law, state law, and then rules. What will change a little bit is some of the terminology when it comes to how you're talking about these patients. Right? So you can see kind of the basic stuff that's going to be applicable is the same as what's applicable now. So, emergency contact information, the assessments, the treatment plans, the progress notes. Well, one of the questions that came up right now had to do with what's the difference between a general consent and an informed consent, okay? General consent is the basic consent to treat, okay? So the overall consent, you're going through it with them, they're consenting to, disclosing that information and all of that stuff. An informed consent is basically where you're changing something changing, like, Chuck, what was it? Neurological, physiological, biological. So if you're changing any of that, that's where you would need to have informed consent. Okay? So for us, right now, a majority of the informed consent we see is when you're doing medication services. So You're changing the med, you're changing the dose of the med, all of that stuff, okay? That's informed consent. And general consent is just basically that consent that they're signing for you to treat, okay? Does that make sense? Okay. Now, for any of you that are familiar with our current rules, when it had assistance in the self-administration of medication, and then we had medication services. One was in Article 3, the other one was in Article 4. If you choose to become integrated and do one of these services, they're all under the same heading now. It's just medication services, and it'll break it down what the medication services itself was and what assistance in the self-administration of medication is. Okay. And you can see it's just broken down. Okay, and then this part is just talking about if you are going to do this, the kind of staff that have to do it, and so on. So if that's applicable, or if you choose to become a healthcare institution doing those services, that's where you would find it. Okay, behavioral health services. The administrator of an outpatient treatment center that provides behavioral health services shall ensure that the OTC does not provide behavioral health service that it's not authorized to provide. Okay, that the behavioral health services provided at or by the outpatient treatment center are provided under the direction of a behavioral health professional and comply with the requirements for the paraprofessionals, the technicians, and we'll talk about what's going to be required for the assessment. Okay. You have to have a personnel member who provides behavioral health service is at least 21 or at least 18 and is a nurse, physician assistant, or behavioral health professional. Okay. That's a change. It's kind of the Doogie Howser exemption, okay? Because we had this issue come up where we actually had a BHP who was under 21. That doesn't happen very often, but, okay? So keep that in mind.
What about insurance? Is it still?
We're going to talk about it. All right, if the OTC provides behavioral health services to a patient who is less than 18 years of age, the owner, an employee, or volunteer applies for and has fingerprint clearance card. Okay, so that hasn't changed. Anyone who basically walks in the building that you compensate or have in the building has to be fingerprinted. Okay, so that goes from the CEO to the janitor that you employ. Okay. Now, as part of providing the behavioral health services at an OTC, you have to develop the assessment. And that assessment, the rule has changed a little bit, okay? If an assessment is conducted by a BHT, now that these are the words different, the time frames, within 72 hours, a BHP reviews and signs the assessment to ensure that the assessment identifies the services needed, or a BHPP, a BHP supervises the behavioral health paraprofessional during the completion of the assessment and signs to ensure that it's meeting the needs, okay? That's a change.
Wait, can you go by that?
Mm-hmm. For a behavioral health paraprofessional, a behavioral health professional supervises the BHPP during the completion of the assessment and signs the assessment to ensure that the assessment identifies the needs. Okay? When we say supervises, we mean they have to be in the room.
That's for the BHP.
Correct.
And so if the BHT does it, you have 72 hours to sign off.
The BHP does. Now, as part of the assessment, you can see here, not a whole lot of that's changed. Okay, so that's still going to be the very now it includes the behavioral health services, the physical health services, or ancillary services that will be provided to the patient.
Is that
let me get back to you. Because I think we do, it's further down the line where it identifies that. So write that question down, so that's one that we can
Cover
definitely.
that in the Q&A.
Yeah. Now, the definition of counseling is offered as described in the OTC scope of services. So you're going to have to identify that you're doing that service. What kind of counseling are you doing? And you have to provide it according to the frequency and the number of hours identified in the patient's assessment. Okay? So, as part of your assessment now, you have to identify some of the stuff that used to be on the treatment plan. Okay? So you have to identify that as part of your assessment. Okay? And that counseling is done by a BHP or a behavioral health technician. Okay? So that hasn't changed. Now, as part of respite, if you're doing respite services are not provided in a personnel member's home, okay? And that respite services are provided in a patient's residence or up to 10 continuous hours in a 24-hour time period. Okay. Now, an administrator or an outpatient treatment center authorized to provide behavioral health services that is approved to provide any of the services in C1 may have a BHT who has the appropriate skills and knowledge established in policies and procedures to provide the services. Okay? So that's part of the grandfathering in as well. Okay? That you will continue to be able to use, you will be able to use BHTs. Okay? And some of this is going to be, this will go pretty quick because in this part it talks about the specifics of all of the integrated health that will fall under potentially an OBHL license. Okay, so as we scroll down, you're going to start seeing it, like 1015 right here, it talks about clinical laboratory services. Okay, this is where our piece starts to come into where it's integrated health. Okay, so if you're going to choose to do any of these, just keep in mind it's in Article 10. Okay. Again, so there's crisis services, and then diagnostic imaging services, dialysis. So for any of that stuff, should you choose to do any of it, this is where you're going to find it. Okay. Now, some of the other stuff, if you choose to do it, is that what Alice was talking about? In a couple of weeks, medical licensing is going to be putting on OTCs that talk much more into the integrated health as well. So we're kind of in both places here. So kind of dependent on what kind of services you wish to provide, even though you're just doing outpatient counseling, which going forward, as long as you're in the same building and the same owner, you can continue to do. And I think this is the majority of it. You can see there was emergency room services. The opioid really hasn't changed much, so the methadone clinics. Management. The respite services, if you would ever choose to do that, that is actually now a behavioral health service, which means if you were to do that, that would qualify as a healthcare institution. In the past, we just used to have that little chunk in our rules that just briefly talked about respite. Now it's in there. Now, one of the things that you have to do that's new is an infection control plan. Now, granted, this is kind of dependent on the services. You have to have a method to identify and document infections occurring in the outpatient treatment center. Now, if you're just doing outpatient counseling, okay, it can be pretty minimal because you're not working. Now, if you were doing integrated health with those kind of clients who you're requiring the integrated health license, that's where this becomes much more applicable. Okay. The emergency and the safety standards, again, part of our kind of motto is we ensure health, safety, welfare. So in here, this is not kind of what the old environmental rules are, because there's a specific area that still talks about that with the physical plant standards. But this is some just additional stuff. You still have to have the disaster plan, okay? But one of the new changes is that you have to do an evacuation drill conducted on each shift at least once every 12 months, okay? As of right now, you have to do it once every 3 months on each shift. That's going to change to once each shift per year, okay?
Would you say every 12 months?
Yes. And it'll tell you how you have to document it. And again, if applicable, depending on what kind of integrated health you would be, would kind of dictate what kind of equipment you would actually have in there. And then this part, it talks about some of the physical plant standards. If you're collecting urine or any stool samples, it tells you what kind of facilities you have to have. Now, this Part B states that an outpatient treatment center licensed before October 1st may have a bathroom that is not for the exclusive use of the OTC if an administrator ensures that policies and procedures are established, documented, and implemented to protect the health and safety of individuals using the bathroom. Okay? So what that basically means is you don't necessarily have to have a bathroom, but you can't have a bathroom. Let me make sure this is right. You don't have to have a bathroom, but being grandfathered in, you can have just one bathroom that's for the use of both. Okay, does that make sense? As part of the grandfathering, you'll be able to use, if you have one bathroom, so say you're doing a substance abuse program where you're doing urine, okay? You can use that bathroom for both uses, but going forward, you will not. You'll need to either have two separate bathrooms, one for the exclusive use of samples and then one for the regular use. Okay, does that make sense? Okay. Okay, I'll turn it over to Alice.
So, as you can see, the DUI services looks very small. This is for the approval, okay, the approval process for doing DUI services. So it did stay under R920.
Does anyone in here do DUI services? Are they familiar? Okay.
Okay. So we'll just kind of go through here. Basically, here's some of your definitions. We're not going to come out to survey. We will monitor you. And generally the time that you will see us is if we see a complaint that comes in. Okay? So all we're going to do is monitor. We'll observe and check the quality of your DUI services. You'll be submitting everything for approval. Okay, so application and renewal. This is, again, the application for the approval. This is not application for licensing. This is the application for the approval process for DUI services. You'll submit your packet into the department. It will be reviewed by our support staff to ensure that all the documents are there. They're not going to look at the accuracy of anything. They're looking to make sure that your documentation is there. So please, when you're submitting this packet, you kind of keep that in mind, that it's going to support staff to review, to do a checkoff list to make sure that it's there. So label things appropriately so it's easier to tell. It's not their job to read a program description or policies or anything like that. Okay, that's us as the surveyor. We will do that. But just make sure that it is marked clearly so that they can ensure that it's all there. Okay, let's see. Oops, what did I miss here? So you'll be notified within 30 days after we receive the documents. So there is a little time crunch on here. So we want to make sure that we have it all together. Any changes that you're going to make, if you're going to stop doing DUI services, or there's a change in your facility name, any of those types of changes, you want to make sure that you give us a minimum 30 days notice of the changes. Okay, the department may rescind an approval of DUI services if the department determines non-compliance with the article and there's a negative impact on screening, education, and treatment that the client is receiving. So you can have your approval rescinded. If you wish to have it reinstated, you will submit an application and then have a written recommendation from a referring court. So the court will have to say, yes, they can continue providing services. We want them to do this. Okay. Now, all that I've looked at up here in R920-107 is going to be the same for domestic violence, but this is specific here, starting with 108, requirements for DUI screening. Same information. DUI screening can be done electronically, and it gives you the information. Brian did talk about the secure connection. Make sure that it's encrypted. Screening is conducted by a behavioral health professional or a licensed substance abuse technician. So this is for the approval process only. Approvals, can't use BHCs. You can only use a behavioral health professional. The different levels, the level 1 DUI, level 2, no changes, everything is good there. So you should be familiar with that. Education, basically anybody can do the education. It's teaching. So if you have a technician or a paraprofessional, they can do that portion of it. However, again, the screening cannot. It needs to be done by a BHP, as well as the treatment, obviously. All right. So here it talks about education. Education, again, can be done electronically if you choose to do so. I'm just going to briefly kind of scroll through this. It's very similar and familiar to what you've been doing. There's a few minor changes in there. Requirements for treatment, again, BHP. The 20 hours of group counseling. BHP, licensed substance abuse technician. Okay, I think that's that. Now let's look at DV, the misdemeanor domestic violence offender treatment. 201 through 207 is the same as the 101 through 107, notifying us of the change, the time frames, getting your paperwork in, making sure it is apparent to support staff of what's being reviewed and checking off that it's in here, the rescinding of an approval and how to get that back. Section 208, misdemeanor domestic violence, offender treatment standards. I'm going to tell you the real big thing here. Where is it at? Treatment provided by a BHP who has at least 6 months of full-time work experience with domestic violence offenders or other criminal offenders, or is visually observed and directed by a BHP with at least 6 months of full-time work experience.
Can I ask a question right quick?
Okay.
With the BHP, excuse me, with BHP, it's not always 6 months with all the ones you said prior to that, is it? As far as experience? What's the difference, BHP and?
Well, your BHP is your licensed professional.
Okay, there you go.
Right.
Just needed to know. Thank you.
Behavioral health professional. Okay. So, with that, I believe we are ready to open it up to questions.